Brian Byers from Cafeteria.com. I'm here with Tanya Andrix, who's heading up the efforts for the Community Cares campus, along with Crossing Healthcare, DMCOC, Baby Talk, and this is an incredible experience. We're going to take you inside to really show you what's being built here, what's coming, and what's already been accomplished. So we're here to sort of break this down room by room, building by building, because fortunately, if you haven't had addiction in your life or your family's life, you're blessed, and you don't have to know about all of this. But numbers say most people don't escape that. You know, their family members, their coworkers, their children, and so this is going to be a unique place that other people pay $60,000 a month, and it's only available to the very, very wealthy in a place like Arizona, which you visited.
Absolutely.
We want to show you what this is going to mean for our community and the second chance it's going to give for people in getting their lives started. So we'll take the tour.
All right.
This is where it starts. This is the beginning.
So you're standing in our medical detox unit. So when people present for care and treatment, the first thing that needs to happen is that we need to figure out how stable they are medically, and also help them through the process of detoxifying off of the substance that they have misused. So there's an 8-bed unit here. It looks a lot like a hospital unit, private rooms for each patient, and this is where they'll stay for probably 2 to 5 days, depending on what substances they've misused.
And this is voluntary. There's a door right there that's unlocked.
Yes, absolutely. And that's what people need to understand, is that you seek treatment voluntarily, and you can end treatment voluntarily. And that is a common thing. When people start to detox or sober up, sometimes they change their mind.
Sure. And not all first chances or second chances are done the first or second time. It's a process.
So we're standing inside a private room. The only thing missing is the hospital bed, which will be installed very shortly. And this is where a patient will stay and spend that time. It's physically very challenging to come off of a lot of the different drugs and alcohol.
Particularly heavy drugs.
And depending on how long a person has used those substances, sort of gauges, and what substances were used, gauges how sick they'll be. We can treat people medically, so we can treat the symptoms of withdrawal, but it's still a process. And so this is where we provide that comprehensive medical attention. Absolutely. And this is one of the common space. So living room, dining room, classroom space are all common spaces.
Kitchen,
and then,
cafeteria.
Absolutely. And then down the wings, or down the residential wings, there is also living space and so on and so forth that is specified to just male and female.
And there's reasons clearly for that as well. So this will be the men's side of this.
Yes.
And then they come out of the immediate detox. They're here for up to 30 days?
It depends. So everybody's treatment plan will be different. That's the average length of stay is between 21 and 30 days. So it's not just a 30 in and out. Correct. It's specified on that person and what their progress is. And so there is, in this space, there's an office for staff because this is staffed 24/7.
24/7. Talk to me a little bit about the decor, and I don't even want to use that word. It doesn't feel institutional.
No.
It doesn't feel clinical.
No.
And you know, you're used to sort of like mint greens and industrial sort of furniture and things that feel, I don't know. I mean, there's a reason why this feels warm. There's a reason why the art is on the walls, which is all Howard's photography. I don't know how many pieces, but there's a specific cause for that.
Yes.
Why?
So everything is meant to be home-like, and so the point of this treatment opportunity for people is to have a place where they can really be introspective, figure out a lot of the things that have happened in their life that have gotten them to this place, and then make a new plan.
Okay, so we're moving into the next phase. Those were the common areas, and then places where on the men's side or the women's side they could gather. Now we get into the actual living quarters, and you can see by this doorway, there's even in this wing there's two distinctions.
There is two
What are
distinctions.
these first rooms for?
So these first 4 rooms, or 8 beds, are for people who have a dual diagnosis or a co-occurring disease process. So they have substance use disorder, but they also have a pretty significant underlying psychiatric reason for that, typically anxiety or depression. And so there's clinical depression or clinical anxiety that needs treated along with substance use. Those folks we have in a separate area, and they'll get a little bit higher level of care, higher in TC, they're closer to staff, higher intensity care. And so they'll have more appointments with psychiatrists, they'll have more appointments with therapists, but those services are available for everyone. But if we have someone who needs a higher intensity of service, we have accommodated that.
And it's the same thing on the other side with the other wing.
For both men and women. And the reason that it's designed this way is because the data tells us that up to 60% of people who have a substance use problem oftentimes are self-medicating. They have an underlying anxiety.
The drug use wasn't
the
problem
drug
to
use
begin
wasn't
with.
the root
It was
cause.
being used to treat
Correct.
the root cause.
Right.
Now clearly there will be sod and grass and landscaping and stuff, but the extras we talk about, having, every study shows, mental health and nature and being able to have access to
Absolutely.
tranquility and outside. That's what these courtyard areas are sort of
Correct.
designed for, right?
So we're standing in one of 2 courtyards that will be accessible to the residential treatment facility, and this is one of them. And this is in between the living spaces of both the women and men's wings. And so, in the evening times, early in the morning, folks will have access to go outside and just be in nature, and
Yeah.
that's the point of this. So there will be furniture, patio furniture, and grass, but we're excited about all of those small pieces to bring some tranquility to the environment.
So this is the cafeteria area, seating area out there. This is co-ed for the entire building. And we'll walk through the kitchen here in a little bit. And for those of you who know Howard, that will make you laugh. Tell me about the partnerships that are going to go on here.
Absolutely.
Because this is beyond, the community is involved in so many ways, but the same will be had for the food that's served here as well.
Absolutely. So we're hiring our own kitchen staff, but then we're going to work very closely with the folks at the culinary school at Richland Community College to make sure that we can provide ongoing and training education to our own staff, and then build a bridge to provide that training and education to people who come through treatment and might need a trade. This would be another location that they could, through a partnership with Richland, could develop that trade.
Same big kitchen serving both cafeterias. Now, this cafeteria will be for campus staff. And for the outpatient residents.
Absolutely. This allows us to also provide a cafeteria for the staff on the campus, so we're excited about that as well. So we're standing in the mechanical room.
This is just one little offshoot that you'll run into when taking the tour. I think people forget the intent from Howard to you to the campus is to give people a second chance and treat drug addiction.
Right.
But they forget what $65 million in payroll looks like. I mean, all the work that had to be done, from water heaters to air conditioners to carpeting to floors to construction, the number of trades that have been involved. People have been at work for over a year.
On any given day, there's between 20 and 100 trades actively working to make this happen.
Okay, so we're now in the transitions building.
Absolutely, yes.
So let's walk quickly through this. You go to immediate detox, 3 to 6 to 7 days. You go to the second phase of that, which is called?
Just your stay in your residential rehab, which is 3 to 4 weeks.
3 to 4 weeks, roughly, depending on the individual.
Correct.
This is the next step.
This is the next step. For people who have a home to go back to and a family that can support them, they'll leave residential rehab and they'll go and get their treatment on an outpatient basis from their home.
But this is the stumbling block for most people, right? They go through a successful rehab, 30 days, they leave sober, but they go right back to a life and the elements that maybe didn't help to begin with.
And if they go back to an environment where drugs are being used, it's hard to stay sober.
And a lot of people, like you said before, they've burned all their bridges. They don't have the economic security to go out and get out of that. They're just going right back into it. So the transitions may be the most important part of this entire campus.
I believe that it is. And so this is a 60-bed dorm, and this is a program. So this just isn't transitional housing. If you are electing to live in this housing, you are signing up to be a part of a program with a 15-page contract that lines out your rights and responsibilities. And that means that you're going to be busy 40 hours a week. You're going to be working, whether that's on campus or an off-campus job that we're partnering with your employer. You're going to be getting outpatient treatment, so you're going to continue the treatment that you've started in your rehab, and you're going to be working with our education and training component to make sure that we have a work plan or a job plan or a career path identified for you, and we're going to work on that. And so this is where you're going to put the pieces back together so that you can be self-sufficient and live a sober life and have all of the necessary tools that you need in order to do that.
Okay. So this will be eventually the front lobby of the outpatient treatment center, and some of this will be opening sooner than others.
Right.
But you're going to have a full dental office here?
Yep, the full dental clinic that'll open in February timeframe. This is also where people will come for outpatient treatment of substance use. So if they're taking a medication like Vivitrol or buprenorphine, we'll have the ability to provide those services here. But probably most importantly, and what we're most excited about, is this also very much like a community college. You'll come in for substance use treatment classes, but you'll also be able to come in and work with our workforce investment solutions folks and our teachers and our tutors so that you can work towards an individualized training education workforce plan.
And workforce development's great at that. And you guys recently got a $1.3 million grant to be able to go towards what they're doing here on campus.
So Workforce worked with Crossing Healthcare. Workforce submitted the grant and was granted those funds to bring $1.3 million to Macon County to work directly with folks with substance use disorder and get them on a pathway towards self-sufficiency.
Part of the same building is outpatient, but this is all about recreation, living
Yes.
better, being healthier.
Right.
There's a theater
Yes.
that not only serves as an entertainment purpose, something to do, but
Yeah.
also a lot of improvisational skills are used
Sure.
in rehab.
Yeah.
I mean, it's an area, a common area
Yes.
where you can bring in speakers.
Yes.
And then we're here in what will be a full
Our gym.
basketball gym. There will be on the other side of this an actual fitness center and a bowling lane. Why is physical fitness so important, a component in this
Right.
stair-step process of getting
Right.
somebody off of?
So we have to approach a person's health and well-being from a holistic standpoint. So things like nutrition, things like diet and exercise, health and wellness, all are incorporated this, so body and mind. And so this gym will be a part of the treatment every day for people both in residential rehab and living in our transitional housing. So PE class, so to speak, is part of treatment.
It's required.
It's required. It's on your schedules.
It's the Community Cares Campus, thanks to a $65 million gift from the Howard G. Buffett Foundation.
It's amazing.